All right. Hi, everyone. I am Anna Nienhuis. I'm here with John Sikkema and Levi Minderhoud from the Law and Policy Department at ARPA Canada to talk about some really interesting recent developments in regard to our Let Kids Be campaign. So we launched this campaign in the fall because we saw a need in Canada for a clear voice against the rapid expansion of medical gender transitions for minors. And clearly we weren't the only ones who thought that this might be an issue of concern and that maybe we should hit the brakes and reconsider this issue. So last week, Alberta Premier Danielle Smith made some policy announcements about some gender identity policies that were going to be coming in the province. And obviously there was some backlash and comments against that. But basically what they plan to implement is that cross-sex hormones and puberty blockers will no longer be available to kids under the age of 16. And top and bottom surgeries will also not be available to kids under the age of 18. So Conservative leader Pierre Poilievre also spoke on this and seemed to indicate his support for some of those policies, although reportedly he asked his MPs not to comment on the issue. So it's become a huge focus topic in Canada the last few weeks, and we just want to talk about some of these changes, some of the counter arguments, what it looks like, whether these things are good for kids, whether this is something we're hoping to see in other jurisdictions. So we just kind of want to get your guys' thoughts on that moving forward. So Levi, maybe you could just tell us, first of all, a few of Danielle Smith's key talking points when she was defending these new policies in Alberta.
Yeah, the highlights and talking points that she mostly referred to was something along the lines that kids don't have the capacity to consent to the procedures at young ages, below the age of 18 or age 16, because of how irreversible and how drastic some of those interventions are. She was talking about how it was incumbent on adults in the healthcare profession to preserve young people's freedoms to make choices about their body, about their sexuality, about their health for later on in life, and not make those decisions at really young ages. And then she also mentioned how she was keeping a close eye on other jurisdictions across North America, some American states, but then a lot of European jurisdictions like Sweden, Finland, Denmark, UK, France, but how all of them have taken similar steps. And so just reiterating that Alberta wasn't doing something completely new in the world. They were following a growing international precedent here.
Yeah, absolutely. And so obviously there were right away people who strongly disagreed with these proposed changes. So I'd like to kind of bring up some of those counter arguments and actually discuss them, see if they're valid, see how you would respond to them. So maybe John, I'll ask you first. The biggest criticism coming out of this is that this is a healthcare decision and the government shouldn't get involved in healthcare decisions. So what would you say to that?
Yeah, I think it's a pretty powerful, rhetorically powerful point. And I think generally, it is a good principle that politicians don't dictate healthcare, or certainly the minutia of how to treat a certain condition, right? But that doesn't mean it's inappropriate for governments to set basic guardrails, right? Especially to protect vulnerable people. So I think what we're seeing in gender medicine today is a case of self-selected specialists, right, in a new and rapidly growing field, right, who are doing, I think, far more than they should. I think several countries doing these reviews, as Levi mentioned, that's something that the Premier has pointed to. They found that this is a cutting edge area. It's fast growing area, but it's gone too far in many ways, and it's doing things to children, to minors, that's rendering them infertile and so on, and that there just isn't good evidence that that's actually beneficial, right? The hope is that it's beneficial for mental health. It obviously has severe physical effects on someone, and lifelong implications. So yeah, I think the government's role here is limited, but it is just that. It's to put some safeguards in place, because medical specialists can go too far sometimes and can do things that that I think society is rightly concerned about.
Yeah, but there have been a lot of leading medical clinics and different specialists who are supporting these surgeries. So they're calling this affirmative care or gender affirming care. So how does that play in to what you just said?
Yeah, I think that goes to I think there is an issue, and certain doctors have pointed this out, but an issue of ideological capture here. So, for example, one of the first clinics in the world, I think one of the first 5 clinics in the world that was helping gender dysphoric children and youth was Dr. Kenneth Zucker's clinic in Toronto, right? It was part of the Center for Addiction and Mental Health. And it was shut down in 2015. He was fired, essentially because of political pressure, because Dr. Zucker's approach was not considered sufficiently trans affirming. He very much favored a wait and see approach, help someone be comfortable in their own body, and hopefully let puberty resolve the gender dysphoria, help to resolve the gender dysphoria, as it often does, rather than step into harmful drugs and medical procedures, right? So that was his approach. Again, not this affirmative approach where doctors are not supposed to question the person's self-identified gender identity or their desire to bring their body in line with that identity, which I think is increasingly prominent culturally. And while certain bodies, medical bodies, take the official position that gender affirming care is the way to go, certain doctors have spoken out to say this doesn't represent their profession as a whole. Actually, there's significant debate and dissent within the profession about whether that's a healthy thing to be doing. But the reality is there is a certain amount of ideological capture of these bureaucracies of some of these health bodies. So Dr. Joseph Zanga, for example, a former president of the American Academy of Pediatricians, he is vehemently opposed to that body's stance on gender affirming care, but he's described how he is really shut down at every opportunity from raising those concerns at any meetings of that body, and how they won't even publish his letters to the editor of their medical journal. So I think there is a certain amount of quashing of dissent, again, not because there's such a strong medical consensus, but really for I think political and ideological reasons.
And that's kind of squashing dissent or different perspectives, John, I think is a great example and a great testimony to how politicized and how ideological this whole frame definitely is. If you're in the scientific community, the medical community for sure, the whole basis of those areas of study is the free and independence and conversation between different people having hypotheses and testing those hypotheses and taking into consideration conflicting evidence and changing your idea, your rationale, your practice based on existing evidence. And so when we see politicians and we see medical bodies and organizations like that really try to stop that from happening, that should really be raising red flags in our minds and government's minds that maybe there's evidence that needs to be considered and there is ideological capture here instead of evidence-based medicine.
Yeah, I think that's a good point, that there's a lot of dissent, but then when we actually look at the evidence, Danielle Smith is saying we've looked at the evidence and we're also following other countries that have already done this before us, as you mentioned, that Canada's not the first country to look at the evidence and suddenly realize that maybe this is something we need to put the brakes on a little bit. But we also know that the UCP party, Premier Danielle Smith, they're all about parental rights, parental choice in education, a lot of these different things. Is just another aspect, would you say, of that trying to give kind of a responsibility or a position back to parents that the government should be leaving with parents in order to require parental consent for some of these treatments?
Yeah, so that's another criticism we've heard, right? Is that the government's saying we want to respect parental authority or parental choice when it comes to education, but we're not going to let parents choose gender affirming care for their kids at a certain age. And I think, look, I think parents' right to direct the education of their children, it's well recognized in our law, but even it has, I think, reasonable limits, right? There's you can't give your child necessarily any type of education you want or not educate them at all. So that right has limits. I think in Alberta's policy of opting in to education about issues of sexuality or gender, that helps parents maintain control of their child's education, a greater degree of control of their child's education in a particularly sensitive area. But when we're going to the issue of healthcare, when it comes to medical treatment, it's true parents can consent or withhold consent on behalf of their child, again, up to a point, right? There's been cases where a child needs care that's essential to them, a parent won't consent, and the state actually takes temporary custody of the child to make sure they get life-saving treatment. So there's limits there as well that the government has set, can legitimately set, and I think the general authority that parents have to make decisions about their child's healthcare doesn't mean parents have a positive right to obtain any kind of treatment for their child, especially treatments that have reasonably been prohibited because they do more harm than good, or because they have too many risks and no proven benefits. And I think that's what we're seeing here? Is the government playing its proper role of protecting people from harmful medical interventions that don't have proven benefits?
Yeah, and even on the parental rights question, I mean, it's good to be clear for maybe for followers or viewers who haven't followed so closely what's happening in Alberta. Like Alberta's suite of policies that announced, there's kind of three main ones. One is about like uh, people competing in female or biological sex sports and keeping that separate. So that doesn't really engage so much on the right of parents, the right of children, and that's a little bit different. What John was talking about is in education specifically, where parents definitely are now given through these policies more choice, more control, more of a say in what their children are being taught. But in the medical transitioning part, the third part, that's not largely focused on parental rights per se. It's actually just focused on what is right and what is good for the children. It's all medical surgeries to try to transition. All of those are banned. Doesn't really matter if parents consent to it or the child consents. The province rightly says this should be illegal for any child under the age of 18, and then also for the puberty blockers or cross-sex hormones under the age of 16, those are entirely off the table too. So the only time that parental rights and parental involvement gets involved there is for that narrow age window from 16 to 18, where minors then have to not only consent to it for themselves, but their parents and other doctors and other medical practitioners, they all have to consent to it too. So it's that kind of window where parental consent is specifically in the healthcare part of these announcements.
Yeah, that's a helpful clarification for sure. So then also we get this question, like you talk about, we're not going to allow these certain surgeries or these cross-sex hormones, and we don't have good stats on how many people are actually being prescribed these cross-sex hormones or puberty blockers, and we especially don't have good stats on whether these top and bottom surgeries are actually happening. So we do know that mastectomies for minors under the age of 18 have been happening. Other surgeries, it's less clear. So why would they ban something that might not even be happening for minors?
So one of the reasons, I think the biggest reason why Alberta is doing this is to send a signal to the rest of the country that these are certain things that, even if they don't happen very often for the surgeries, like you said, there's some studies, some data done by the National Post that there are hundreds of young girls and women that are still minors that are getting those gender affirming or medical transitioning mastectomy. So that does indeed happen. I think they actually even published some Alberta specific data recently. So that does happen. And so, but the province is saying we don't want that to happen at all, but we also want to send a signal that we don't think that children are in a position of life to make those decisions there. And so what we want to do as a province is to just set those bars and say, this is the minimal capacity, the minimal age that you need to be in order to actually provide meaningful consent and informed consent, knowing what the risks are, knowing what's going to happen to you and your body for the rest of your life, and sending that signal to just not just actually the minors, the underage children in the province, but also the adults in the province, and actually people across the country taking a stand for what they think and what they found in the medical literature to be the best action here.
Yeah, and I think that's a good reminder too, as you said earlier, just a policy that's focusing on what's good and right. So even if it's never happened that a minor, like a 14-year-old has had a bottom surgery, who's a boy who doesn't want to be a boy, even if that has never happened, for the government to say it should never happen, that's something we're actually willing to stand behind for the good of kids, because that's a hard, that's a consent they cannot give yet at that age. They don't understand the lifelong implications of that. So to take some of that responsibility off kids and say, we're going to let kids be kids, and then those decisions are going to come later in their life.
I think a good argument can be made that the age should be even higher, right? It is 18 for what are euphemistically called bottom surgeries, but there are, we do hear plenty of stories about detransitioners who did have those surgeries, which are obviously very consequential, that can mean sexual dysfunction and lifelong infertility when you have certain surgeries done to your reproductive organs. Arguably that could be raised from 18 to closer to 25, because there's lots of detransitioners in that age group or who had surgeries done at that age. And of course, at that age, your brain isn't fully developed. You haven't actually had the chance to live as a sexually mature adult for very long at age 18. And so obviously this in one way you could look at the age of 18 as in a way a compromise, because I think a good decent case could be made to make that that age of consent for these types of procedures older.
All right. And when we talk about the puberty blockers and the cross-sex hormones, so puberty blockers have been described as kind of a pause on puberty. So kind of giving kids time to figure out where they want to go with their gender, what they want to do, who they want to be. So pausing those or blocking those, sorry, for minors basically means they're off the table, right? Because puberty blockers, people will have already gone through puberty now by the time they're getting there. So basically they're saying puberty blockers are not going to be happening in Alberta. And why would that be something that would be really beneficial for kids?
Well, fundamentally, because puberty is a stage of growth and development that God has given to all human beings to like grow and mature. Like if you don't go through puberty, you are being not just pause as like as a euphemistic or a nice way of putting it. You're actually being stunted in your physical, emotional, sexual growth. And we know from the scientific studies that the vast majority of children who have gender dysphoria before puberty, by the time they go through puberty and start reaching adulthood or older adolescence, they will naturally start aligning and understanding the body in the way that God has created them, and that gender dysphoria will subside. So puberty is actually, in most cases, the best remedy for gender dysphoria. But by giving children puberty blockers, that stops them from going through that process, which naturally helps them to grow, understand, and work through that gender dysphoria. And so that's one reason. But another reason is that there are all sorts of medical consequences of starting puberty blockers early. I mean, John already just mentioned there's risks of fertility and sterility, particularly if you're on them for any long length of time. There is some evidence about them causing osteoporosis, weak bones. There's brain studies that say that you can't pause the development of a brain. If you miss out on a window, stop it from developing in a certain window, it's never going to actually develop the way it should later on. So there's all sorts of different physical side effects and consequences of going on puberty blockers at a young age and continuing them for a very long time. So it's good that Alberta says that, yeah, effectively, no child should be skipping the process of puberty. They should go through puberty, have those changes happen that naturally to them before they consider anything else.
Right. So it's not really just a pause. There's a lot more to it. It's not that we can just pause puberty and then nature will just accept that and carry on as usual, that it has much larger impacts.
Right.
I think it's worth pointing out as well that the data shows that while puberty blockers are a pause button in theory, in practice they are really a start button for transition. Almost everyone who starts on puberty blockers ends up taking cross-sex hormones and often getting some kind of surgery. There's obviously a whole suite of surgeries you may or may not get, but if that's the case, right, then it's kind of a question of how early can you let someone get on the conveyor belt of transition, right? If you start at age 10 on puberty blockers, is that, as does happen, right? Is that an age where you can really understand the implications of that? And not only that, but even based on your fear of going through puberty, of sexually maturing in your natural sex, are we willing to let basically someone at that age make that decision and prevent that, like Levi said, that essential stage of natural development, which has all kinds of implications, even for some evidence suggests for cognitive development. I think that's the issue here. And so I think it's not surprising that some European countries have, even when it comes to puberty blockers, made sure that effectively you can't get those till you're a bit older, till you've actually had some physical maturation happen. And then we actually see what is the impact of puberty on your gender dysphoria. Does it grow severely worse? Like, how long have you had it, first of all? And does it grow worse through puberty? And even then, a lot of these countries are saying only carefully selected people for clinical trials, right? It's not a generally offered thing anymore in a lot of these quite progressive countries who have done these comprehensive reviews of this area of medicine.
Yeah, so essentially, like you said, John, just to pick that one thing out, puberty blockers start to get you on the train of the entire medical transition, because almost everyone who goes on puberty blockers continues down the road. And that is one of the reasons why a lot of the staff at the Tavistock Clinic in the UK, that was a bombshell in their minds and saying this is not a neutral intervention. We are actually actively pushing them by encouraging puberty blockers for them to transition further and further later in life.
Yeah.
All right, so that's kind of some of the main talking points against the new policies that are being suggested. And it's clear that you think they can all be pretty easily refuted. Like the idea of gender affirming care, the focus should really be on body affirming and letting people grow and develop naturally. And then whether that dysphoria desists or whether they need other mental health care or other areas, but basically just allowing kids to be kids and to grow and develop without having to think about whether they're in the right body or not. So this hasn't been implemented yet in Alberta. And now with all this pushback, Danielle Smith has said, oh, yeah, we need more input from LGBTQ groups. We need to figure out exactly how to implement these. So I'd love to get both your thoughts on where do we go from here? Is this something that we're going to see implemented? Are they going to get pushed aside? Are we going to see it followed in more provinces? Is it going to be a big part of federal elections? Just kind of your big picture thoughts or predictions on where you think this might go.
Yeah, on the larger, I'll take a stab first and say like a larger picture. There's two ways I can think could go. One is that you can kind of view this issue as a pendulum, and the pendulum has swung so far to one side, and now we're starting to realize the excesses and the extreme of that side, and so it's going to start sliding more towards the middle in forms of policies like this, like banning medical transitioning for minors, and maybe it'll go past that in the future. So that's one option, the option that I pray that is happening. The other option is that this is simply a temporary setback in what is a larger cultural march towards filling what your preferred descriptor is, post-Christianity, a society that rejects God, a woke culture, a progressive culture, any types of words there, and that this is simply a pause on that that won't stick around. So that's the pessimistic view of what could happen on the larger side. But John, do you have any more thoughts, like more specifically to provinces and federal governments?
Yeah, I think some provinces will probably kind of wait and see what happens here. I mean, we're obviously expecting legal battles. Those have kind of been promised. I can see, based on our kind of court jurisprudence, our courts seem to be quite highly in favor of kind of patient autonomy, what the patient thinks is best, and even kind of our jurisprudence on substantive equality, right? The idea that this would be members of this population would be considered a equity-seeking group, and if these types of treatments are their way of seeking equity and getting what they want in life, I think there's reason to think that courts will be sympathetic to that, and I think a lot of it will come down to the kind of experts, the battle of the experts in the courts. Can you justify this in terms of any proof of medical benefit to these types of medical interventions versus the known risks and harms, many of which, I mean, there's too many to cover in our discussion here, but we have a policy report where they're talked about in more detail. Anyway, so I think in some ways this might get slowed down just through other politicians waiting to see what happens in the court, and possibly if the province loses in court, gauging what is the level of public support for these types of restrictions, despite what a judge may say, and then whether that leads to the political will to use the notwithstanding clause, right? To say whatever the courts say, we're still not going to let this be done to children. It's just unconscionable. So, yeah, I think I'm glad this has happened. Of course, I think this will be something that we continue to see discussed, especially at the provincial level and in courts and in media. I think there's probably a certain desire among a lot of federal politicians, conservative politicians, to not make this a major issue of focus. But I'm hopeful that some federal politicians as well are prepared to look at whether the federal government has a role in ensuring that young vulnerable people are protected, and that these medicines are used appropriately.
And like you said, John, at the end of the day, the federal government could have a play, but this falls squarely in the realm of healthcare in provincial jurisdiction.
Yeah.
Unfortunately, like I said, it shouldn't be considered healthcare, but it is considered healthcare medical transitioning. So it will fall to provinces. And so if there is further action on it, I wouldn't expect to see too much of the federal side. It probably would be the provincial side where governments, particularly conservative governments in smaller provinces, might consider going further and implementing them in their own provinces. But it is going to be a harder slog and a harder sell in larger provinces, places like Ontario or Quebec, or provinces that are already ideologically very much in favor of gender identity, like unfortunately here in British Columbia. Those provinces are going to be much harder to crack into, but I do hope that one by one, we'll start to see the jurisdictions follow suit. Right now, we're at one of 13 provinces and territories. So we hope that all of you and the ARPA supporters and Christian community across Canada will help us to expand this from one jurisdiction to all 13, and that we can work together to help let kids be.
Yeah, it'd be very helpful if other provinces don't take a wait and see approach. They should take a let kids be approach, but if they don't take a wait and see approach, just because it is helpful to have, I think, multiple provinces on the same side of a legal issue, right? If it does likely end up in the courts. Yeah.
All right, thanks, guys. That's super helpful, and I think it's good to know what the other side is arguing too, to be able to not just have our talking points, but to say, okay, what are they thinking? Where are they coming from? To be able to understand their arguments, to be able to engage with them. So this has been really helpful. So thanks so much.
Thank you.
Okay, thanks. Take care, everyone.